Okay, thank you everyone for being here. Miigwech gabijay kuma ekumina nin Sol Mamakwa kazwetu giskwasiabungduji. My name is Sol Mamakwa. I'm the MPP representing the riding of Kiwetnuk. I'm very glad to be here with the community of Cat Lake to support them on and help them share the message that they have today on the issue of housing. Before again, I want to acknowledge the people of Cat Lake First Nation, the young people, the elders, the other leadership that's in the community. And then also good afternoon and to all of you, and especially to our guests representing the leadership of Cat Lake. In attendance is from the community is Deputy Chief Wesley, right next to me, and then Councillor Joyce Cook. They have come a long way to talk to you about the state of their community. As an MPP representing Cat Lake, I want to ensure that their message is heard widely and that the provincial government is upholding its obligations it has to the people of Cat Lake. As a signatory of Treaty 9, we call on Premier Ford, Minister Elliott, Minister of Health, Minister of Indigenous Affairs to provide the support as requested by Cat Lake First Nation. In a statement to the press earlier today, we heard Greg Rickford, Minister of Indigenous Affairs, state that they've had discussions with the Chief and Council of Cat Lake, spent a great deal of time with his community, working with the stakeholders, and the intent to get back to the Chief. The government, the federal government has done very little on this. That's the end of quote. According to, and then the leadership here will speak more of that issue about the contact with the minister. And again, we urgently remind Premier Ford that as a signatory, Ontario has a responsibility to uphold its treaty obligations in this case, and in all cases related to First Nations communities that make up Treaty 9. Similar to health crises declared in other regions and Treaty 9 communities like Saskatchewan, Attawapiskat, Ontario has a critical role to play, ensure that children, families, elders are safe. We also support Cat Lake's emergency declaration of Jordan's Principle and request that Premier Ford work with the community to provide the basic health care to the children now. And I'll hand it over to Deputy Chief Wesley.
Hello, I'm Abigail Wesley. I'm the Deputy Chief for Cat Lake. I'm here to speak on behalf of my community. I'm here to voice out my concerns, and I am hoping to be heard. This is my wish. So I have a summary here I want to read out. And on January 16, 2019, the First Nation community of Cat Lake called a state of emergency due to the poor condition of housing and the health of the residents. Since 2006, the Cat Lake has been asking for help from the federal government. Fast forward 13 years to 2019. Nothing has been done. No action has been taken on the rapidly growing infection of mold. The government of Canada is not recognizing and not taking action on the mold problem in the north, especially Cat Lake. So let's examine this for a minute. Environmental health officers working for the federal government know that there is an issue with mold in the houses along with rapidly deteriorating housing. Everybody ignores this, especially the federal government. People in Cat Lake get sick non-stop. coughing, multiple pneumonia incidents, related kidney diseases, and increased medical problems. Medevacs occur almost daily. As a matter of fact, we have almost 100 children needing assessment for serious health issues. Federal government continue to ignore and demand more paperwork, proof, and study. Well, time is done. Waiting is done. No more Cat Lake can wait. Underfunding is the real problem here. We are 1 month into a state of emergency, and the only committed item is a switchblade cover, which have yet to receive. Recognize, admit, options, solutions. That's what this is about. The deaf ears of the federal government are about to get a hearing aid. We formally call on Premier Doug Ford to meet with us and work with us to solve the housing and health crisis. Mr. Ford, come to Cat Lake, meet with us, see the situation firsthand. We call on the province of Ontario to step up to the plate and fulfill the duties of the 1905 Treaty 9, which Ontario signed as a signator, not as a recipient. We now call on Premier Doug Ford to come to the table with Cat Lake and its advisors to order and to provide the temporary emergency housing that was announced earlier today by Mr. Rickford this morning. This temporary housing is drastically needed so we can build the 92 homes designated in the ISC-funded report for immediate demolition due to the amount of mold, the bare wires, the shifting and cracked foundations, which in some cases cause the houses to be falling down in a hill while families are living in them. We again officially invite Ontario to come directly to Cat Lake to assist us to force the federal government to act. And if Ontario can make a huge amount of money from Treaty 9 territory, where is Ontario with this state of emergency? After reading this summary, I am a mother of four and a grandmother. You know, seeing these children medevaced in and out, it's really heartbreaking. And this is the situation they live in, and we can't do anything about it. We don't have housing sitting beside you that's empty to be where you can go and live. We're very isolated. We're only on a winter road, maybe for 4 to 6 weeks, and that's why we need the action taken as soon as possible, because if this doesn't go through before the winter road is closed, we're going to have to wait another year. Mm-hmm. And that is something that I want action. I want answers now. I want something done. It's been 1 month already, and I don't think it should take that long to give us an answer. I want the answers. Thank you. I'm done.
Joyce Cook, Councillor for Cat Lake First Nation. We come here today with the concern of our young people. As leadership in our community, we face many challenges. We go through so many climates to find the documentation, the reports, to hand to the federal government that needed that information, but yet it's hard for them to believe the reports they receive. Regional Director General of Indigenous Service of Canada, came to our meeting yesterday. She had no interest what we had offered on the table. When is the federal government going to help the people? We are the First Nation people of this country. When are we going to be recognized? I know Canada has donated billions of dollars to other countries. What about the people of this land? We are the grassroots people, which means we don't own the land owns us, because we are from Canada and we are First Nation people. When they talk about mold, what it represents to me, and I told that lady, yes, I'm going to repeat myself. I don't care if I repeat myself 100 times, and I'm going to repeat it till I get answers. When is help coming? Is Ontario going to act on it? Why is it taking so long? When there's a crisis in other countries, you're there in 24 hours. But when there's a crisis behind your backyard, our homeland, nobody's come. When we signed that treaty, we took care of the people that came from Europe. But when are they going to take care of us? When we signed that treaty a long time ago, what the government had did is give blankets to the First Nation peoples with infections that almost demolished half of our people. And this is another form of the blanket, is the mold. That's what it represents to me. I speak on behalf of my people. I speak on behalf of my children at home. And I get emotional when I speak, because every time somebody tells me a story of who they are and what journeys they have come from, it impacts me. When we have doctors coming in to do research. And when our kids go to the nursing stations, they're only given creams and puffers to go home, you know. Why? Why can't we get the proper health care that we need? Aren't we Canadian citizens too? Aren't we recognized as Canadian citizens? When they speak Indigenous people, what does that mean to them? We are Indigenous people. We're the land of this country. We're the people of this country. And why are our children not being heard today? When I asked the federal government, would you live in those homes you've seen? I asked him 3 times, he said no. Why do our kids live in those homes? Would he move his grandmother in there? No, he wouldn't. His answer is no. Why do our elders have to live and suffer in those homes? You're not only hurting the children and the elders, you're hurting the young people, mentally abusing young people. It's become a bigger problem, mental health problem. Because the skin infection and the lung infections they have has become their identity. Mm-hmm. You know, taking somebody's identity is wrong. And I come here today because I want help today, not tomorrow, not next week. And I don't know why it's taking so long for the federal government to move. To me, it's like we're not even being recognized or heard. It's just an echo through the woods. Thank you.
Il y a 5 semaines que la communauté de Cat Lake a déclaré un état d'urgence. Et la communauté sont très frustrés par le manque d'action du gouvernement fédéral et le gouvernement provincial. La situation à Cat Lake est extrême. Cette semaine, 2 enfants étaient évacués à cause des crises médicales. Maintenant, il y a 100 enfants qui étaient affectés par les effets des moisissures, les bronchites, les pneumonies, les éruptions cutanées. Ce n'est pas acceptable au Canada d'avoir une situation que les enfants et les aînés étaient à risque à cause des détériorations des maisons. Nous sommes ici à Queen's Park pour demander au gouvernement provincial de jouer un rôle positif avec les communautés. Pourquoi? L'Ontario était signataire du traité 9. Et grâce à ce traité, Ontario a reçu beaucoup de richesses, des ressources naturelles, des territoires de traité 9. We are here today because everyone is aware that the federal government is doing nothing to help the people of Cat Lake. Nothing but vague promises, nothing but assurances that somehow things are going to get better. But the community is frustrated, and they're looking to Ontario and saying, why the silence? Cat Lake is in the province of Ontario. Where is the province of Ontario to do their part? They signed the treaty. They received the riches off the land that is not going to the people of Cat Lake. So there's a number of steps that the province can take immediately to help. Number one, we've heard the minister talk about emergency housing. Well, yes, where is it? Come to the table. We need a team going into Cat Lake from the province to start addressing the crisis that we're facing in terms of the overall housing, the medical crisis, a full assessment. We also have 100% of the homes are at risk of fire. We want a fire team to come in and help the community because we have children in basements that are sleeping beside wood stoves that are not safe. People can die and people will die if nothing's done. And we're also here to say that if we do not get the support that's necessary, the community is looking at calling for an evacuation because we cannot leave children and elders at risk anymore with 100 children who have been identified right now of being affected by the mold. We have numerous health conditions that are affecting the families. We cannot leave the community at risk any longer, so we're asking the province to understand that this is an urgency. If there was a state of emergency in Brampton or Waterloo, we know the Premier and the Prime Minister would be there immediately, but nobody bothered to show up in Cat Lake. It's got to stop. We're calling on the province to come to the table. If not, the community will declare a state of emergency evacuation to get people into safe conditions. So I'll turn it back to Sol and for questions.
I'm not sure if there's any questions for the community leadership.
Radio Canada, the French CBC. So you alluded to it earlier, Minister Rickford said he was in contact with leaders of your community. Can you tell us exactly what you have been telling Minister Rickford, what you expect specifically from the province on this?
He's asking about if there's been contact with Mr. Rickford, with the Chief and Council. That's what she's
I know,
asking.
yeah, the chief has been in contact with him, but I don't personally know what, like, we never, I know the chief and Rickford are talking.
At the beginning.
Yeah, at the beginning,
That was it.
that's it, but I don't think we've heard anything from him since.
So specifically from the province, and maybe this is because MP Charlie Angus referred to Treaty 9, saying he wants to see the provincial government play a positive role. Can you just elaborate a bit? What does that? What exactly is the specific role of the province here?
It's the province, typically what's been happening, especially with this issue, anything that happens on reserve, the province, whether it's the ministers or the premier, they'll refer to the responsibility of the federal government. And our people are always played in a game of jurisdictional ping pong between, and they fall into this jurisdictional black hole of services or programs of getting help. And I think we have an issue that's related to a lot of children, like they said, almost 100 kids that have a lot of skin conditions, and also young people that their state of mental health is is very questionable, perhaps high risk, and we need to have a system where we bring in a team, a medical team perhaps, to assess the situation, community health assessment. And not only that, mental health. And so it's a really, it seems the way the system is built provincially, if we're on reserve, if we're First Nations, and then we're on reserve, we do not matter under the provincial system. And I think, we are part of Ontario. We are part of Canada. And then Ontario is a signatory to the Treaty 9, which is Catholic is part of. So we got to end this the jurisdictional ambiguity that exists within the system. We are people too.
You mentioned about the potential for an evacuation emergency. What exactly am I to understand by that, and how would that play out?
Well, when we left Cat Lake, everybody was getting ready where to go. They're assigning people going back to their traditional land, their trap lines is what we call it. Because, these homes are not suitable.
So you're not talking about the kind of thing?
No, we're just going to evacuate. That's it.
You will leave the community?
Yes,
and
we're
go
going to
back
leave
on
the
land?
community. Yeah, we're going to evacuate.
Some may go to the land,
Yep.
some may have to go to city for hospital. We can't leave them in these homes.
No, we can't.
But the province has the obligation to initiate. If the community calls for the evacuation, it's the province's responsibility, and they can build a fed. So the community will decide where people go. But we can't, we're a month into this and nobody showed up. The community can't keep waiting. So given the level of health risk, they will have to make assessments. Some may go to their territory, some may have to go to the city. We don't know. The community's assessing that now.
There's a statement from Mr. Regan saying that yesterday there was a meeting talking about completing the ice road as a priority, that understands the issues.
Yes, they got off topic. Yeah, the state of emergency is about mold. It's not about the winter road. It's about mold. Why worry about other things? We're concerned about the children's health care. We're not. We don't see our kids running around the winter road. No, we're concerned about the mold in the homes. They got off topic on that meeting.
But in terms of fixing or trying to address the mold problem, is transportation not a critical
That's
part
just
of it?
another holdback for 2 weeks. We want to deal with the mold today, and they're going to find every excuse not to give us what the children want in our home. We want better health care, and we want our children treated.
And living in a healthy environment it's really hazardous living. Every living human being probably in the community is living in a hazardous houses. It's really bad.
No, I get that, but is not being able to get supplies and get new housing materials in, get new medical supplies and all of that, isn't that in part dependent on transportation and the road?
It's open.
It's open now.
The road is open.
I don't know why it took the Regional Director General of Indian Affairs to go digging around the information of the winter road when she can collect third-hand information, but we give her the proven facts that people are suffering with mold through Health Canada, and still she wants to assess those for another 2 weeks. I don't get it. Does she want to deal with the mold? Or does she want to deal with the winter road? We're here for a mold issue, and that's what we're here for. We're not here to talk about other things. We're here to talk about the mold and our children that are suffering.
So then, sorry, so what is the first step to deal with the mold problem? What is it that?
The first
This
step
is
was
not-
taking them to the nursing station to be assessed, which we got, and we got results for that. And nobody has met us. We're in an isolated community. We have no shelter elsewhere. All we do have to go home, back to our mold houses, right? That are unsafe. The breathing environment is not safe for the children. Our children are suffering if you haven't seen those pictures. Every day, there's 96 medevacs a year. That's like 3 times, right? Every 3 days, medevac comes to our community. Sometimes every second night. It slows down sometimes in the summertime, but it really flares up in the winter time.
Yeah, I mean, a month ago, the community reached out with the state of emergency and laid out what needed. We needed a medical assessment. It didn't happen until the community called for Jordan's principal declaration that forced the government. The community said they needed to get emergency trailers up the road. To do that would begin negotiations, because you need to find where you're going to get the trailers. There's been no conversation with the federal government about that whatsoever. So yesterday they showed up in the community and said they were worried about the winter road. Well, the winter road's open, but we have a very narrow window. So we've lost a month. To get emergency trailers in, to move people into, it becomes very problematic. That's why the community's frustrated. The government can talk the clock on this because they know that the winter road will close very soon. So why in a state of a month we've had no action, other than literally the 2 weeks ago they promised to send up electrical covers because 100% of the homes are at risk of fire. Well, that's not a plan. So the community's frustrated. They want to know who's going to work with them.
In Section 67, it says, everybody in the province of Ontario should be eligible for better health care. Where's our health care? I'm asking Ontario, where's our health care? Where's the children's health care? Human rights for children is, where are they? Isn't the government always talking about the better welfare for children? Where is it? Don't our kids apply to that? Or is it because to the government we're not, we don't have human rights? Do we? Where's our rights?
We can provide you the assessment that was done of the fact that 75% of the homes need to be torn down. It's my understanding, Deputy Chief, that the government doesn't want to look at that report. They want to go off the old reports that don't have accurate information. This was the latest engineering reports that show the houses are at risk. We can provide that if you need that.
Let me ask you just one last question, if I might. This is not the first news conference of this kind that I've seen. This is not the first state of emergency declaration that I've seen, that any of us have seen. We've had Peak, we've had Attawapiskat, we've had, the list just goes on and on. Does any of this matter at the end of the day? Does any of this make a difference?
I'll answer to that. It's because the government makes policies. When they signed that treaty in 1905, the government made all the policies, but the government never sat down with the First Nation people to make the policies with the First Nation people. The First Nation people are to live by the policies, but when we live by the policies and when we meet the standards of the policies, they change the policies because they're the policy changers. We can never require and meet the standards of the policies of Canada and Ontario. Hope that answered your question.
Okay. Thank you.
Thank you, Miigwech.
Thank you.